And here we are at the big raise for healthcare in beautiful St. John's, Newfoundland. A lot of excitement out there, a lot of people having fun, playing cards, but most importantly, raising money for a good cause. I'm Alan Dale with Gale Force Wins. Sir, why don't you go ahead and introduce yourself and tell us what you do?
Yeah, thanks, Alan. I'm David Diamond. I'm the CEO for the new provincial health system, NL Health Services. We've been around now, I think we're in our 11th month. Since April, and so NL Health Services runs healthcare here in St. John's, the eastern urban area, and we have 5 zones across the province, all the way up to Labrador. And so that's what I do on a daily basis. We've been involved in the transition from 5 organizations, the 4 previous regional health authorities, and NILCHI, the Center for Health Information. We've come together since April, and we've been doing the transition and working on a lot of the recommendations from the Health Accord. People in Newfoundland and Labrador will be familiar with the Health Accord process. Sister Elizabeth Davis and Dr. Patrick Parfait, who did work and made a series of recommendations, changes in our healthcare system that need to happen over the next 10 years. And so that's what we've been about, putting an organization together, looking at those recommendations, trying to do the things to improve the system for the people of the province.
Wow, it sounds like amazing work you're doing. Here we are tonight, of course, raising money to inject into this system to help out wherever we can. How important it is events like this to the healthcare system?
Well, they're critically important. You know, we've been very fortunate, and we are very fortunate that NL Health Services, we have great relationship with the government, with the provinces, Newfoundland and Labrador, and there's lots of money flowing into the system for various improvements. A lot of the things in the Health Accord, improvements in primary care, mental health, cardiac services, for example. So, we're spending a lot of provincial money, but there's lots to be done. And so the work that the foundations do, and we have many foundations across the province now in this new organization, and the Healthcare Foundation here in the eastern urban zone is one of the biggest, and they raise a lot of money for us each year. And frankly, there are some things that we're doing in areas like cardiology, some of the work we're doing redeveloping the emergency room, some of the work in mental health, in long-term care, really across the whole continuum of services. There are things that we're able to do with the money that we raise from events like this that otherwise we couldn't do. So we're very appreciative of the work that the Foundation Board does and the many volunteers that are attached to the Foundation. And of course, it couldn't happen without the members of the public, the business community, various organizations, individuals who come out for events like this, who give not just of their time but also of their money, and that comes back around to us as the leadership, as the frontline staff, as the people who provide service in the province. Again, as I say, there are things that we're able to do with this money that otherwise we wouldn't be able to do, and that all comes back for the good of the people. It's not about the organization. It's really what we can do for people. So events like this tonight, when there's $50,000, $100,000, $200,000 worth of money that gets raised at some of the events like this, is really critical to keeping things going and keeping things moving forward. We don't want to be going backwards. We know there's lots of needs here and across the country. Everywhere you go in health systems, there's lots of needs, and that's the case here in Newfoundland and Labrador. But we're very fortunate at this point in time with the government that's been very supportive, and with the public that's been very supportive, and folks in the community who come out to events like this, and you put all that together, and we're moving in a good direction, I think.
It's the way you so perfectly describe it. I mean, there's complex, there's challenges, there's a lot of things out there, a lot of moving parts in your world. But to counter that, you've got a beautiful collaboration of government and industry and community, everybody coming together to lean into this.
Yeah, absolutely, and it takes that. As you say, this is really complex. I can't do it. One individual as a CEO, a government can't do it all. it really takes all hands on deck, and that's actually what it feels like in the province at the moment. A bit of an all hands on deck, and that's across government. It's the government, is the folks in the opposition who've been supportive as well, and so we're feeling like we're in a good place to move things forward. A lot's been done in the last 10 or 11 months. We've put a new organization together. We've got a new leadership team in place. But we've been at the same time working on improvements in surgery and improvements in access to cardiac surgery, as an example. And we've just recruited 2 great surgeons to come here from Ottawa, and we're doing more cardiac surgeries now than we've done in a long time. Hip and knee orthopedic surgery, we're doing more, and we've got plans to enhance capability there. Similarly in cataract surgery, and that's happening here in St. John's, the Health Sciences Centre in St. Clair's, and in facilities all across the province. And is one of the exciting things for me in this role is to be able to see how it all can link together. So in my previous role in Eastern Health, of course, I saw what's happening in the urban zone. But now in this role, where I get to see how that connects to Gander and Grand Falls, Corner Brook, Goose Bay, how we can improve services to folks on the coast of Labrador, it's a very exciting time. And again, I go back to the importance of events like this is because the Healthcare Foundation, as one of the major foundations in the province supporting healthcare, also have that very broad vision. If we're able to improve cardiac access to the cardiac cath lab, for example, which the Healthcare Foundation has helped us with, that's a benefit to people wherever you live in Newfoundland and Labrador, because we have one cardiac cath lab and it's here. And so if the foundation, through events like this, are able to help us, we're in the process now of developing the 4th cardiac cath lab. We've traditionally had 3. Now we'll have 4, so that'll be better access to people across the province. We've got this Heart Force 1 that we talk about over the last few months, where we've experimented with flying people in the morning from parts of the province. They get their cardiac cath procedure throughout the day, and then they fly back in the evening. And so all in one day, and we don't need beds. People get the care they need. They get it very quick, and they get it in a timely way. And the foundation has been very supportive of a foundational piece, I suppose, if you will, for services like that. And the money that's raised in events like this is really critical to us being able to think outside the box.
Yeah.
We say we get lots of money for all kinds of different things from government through a budgeting process. But in order to think outside the box, think about things like Heart Force 1 as an example, think about new equipment, leading edge. The Healthcare Foundation has been supporting us in our innovation strategy, which was in Eastern Health and is now a provincial strategy. And so, again, I could go on and on about, we're very excited for an event like this when you look around the room and the place is full. And it's, some of these are people that we see at lots of events.
Right.
And so we have lots of people who volunteer time after time. We never take that for granted. We have people who come out and support with their money and with their presence at events like this. And we see many of the same folks come out and support us event after event, and we're very pleased with that. We never take it for granted, and we're very thankful for the support we get from the community here.
You described it as an all hands on deck event, so perfectly put. But when all hands come on deck, you also need a steady hand on the tiller. You need solid leadership to navigate what could be some tumultuous waters ahead. And you seem like the right fella for the job, and we certainly are pleased to have you in the conversation tonight.
Thank you very much, Alan, and thank you for your role in volunteering this evening as well. Thank you very much.
Pleasure.